Today I'm going to talk about the advantages and disadvantages of implementing the electronic health record system. Whether or not to implement the EHR to the healthcare system has become a controversial issue among healthcare providers. On the one hand, some healthcare providers believe that EHR will dramatically reduce the medical errors and increase the saving and revenues. On the other hand, others believe that EHR system would be an obstacle for their productivity, since some have experienced a negative impact of implementing EHR to their organization. Why should healthcare providers implement EHR? Integrating information technology to our healthcare system can be beneficial for more than one reason. First of all, the healthcare ecosystem is very complicated, from patient-physicians roles to all complicated procedures. This complexity needs a system that regulates and eases its procedures to the least possible time and cost-consuming. Second of all, we are in need to reduce the medical errors as possible as it could be. According to the Institute of Medicine, between 44,000 and 98,000 Americans die each year from preventable medical errors. Finally, we are in need to store patients' records in a safe location to avoid losing them for any circumstances. Hurricane Katrina was a great example for EHR need. But the question is, what type of EHR should be implemented? EHR could be helpful when the right method is implemented. That could be done if the healthcare provider acquired the essential technological elements from the vendor to its organization. EHR has many positive impacts. It improves the quality and safety of patients' healthcare. It allows physicians promptly to access patients' records whenever it's needed, such as patients' charts, medications, images, and etc. It has the capability of analyzing patients' medical information to generate medical recommendation. Additionally, it has an automated alert system that reminds physicians of their patients' upcoming necessary operations, medications, and etc. It reduces the storage of paper records. It has the ability to save patients' records and retrieve it at any time. Finally, it increases saving, thus revenues. This table is conducted from a study that illustrates the costs and savings before and after implementation of EHR. By observing the yearly cost of each area affected before and after the implementation, one will find that the costs were cut by half after the implementation, and in some areas, like mailing and superbills, were no cost at all. On the other side of the coin, you'll see some people, like practitioners, experience a negative impact from implementing the EHR. They found that EHR is relatively costly due to its implementation stages and staff training. Therefore, they consider it as a time and money consuming. Some physicians observed that utilizing the EHR decreased their productivity because they're spending much time on data entry rather than patients. EHR increased patients, nurses, or physicians' frustration when accessing data record delay. One of the major complaints about EHR is its incompatibility of accessing any records by different parties at the same time. Finally, unintended consequences might emerge, which could cause unacceptable harmful outcomes. One of these reasons is the incompatibility between the healthcare busy flow and the EHR implementation. This chart is an example of unintended consequences caused by implementing a CPOE system to the Children's Hospital of Pittsburgh in October 2002. As you can see, the mortality increased after the implementation. In conclusion, healthcare information technology has its own advantages and disadvantages. But working on the advantages could optimize the use of this technological convenient tool by assessing the organization needs and choosing the right software method. By scheduling time for the implementation stages to avoid the chaos during the implementation which cause risks. By continuously training the staff, and finally by continuously evaluate the implemented system to predict any flaws and repair it promptly whenever it's needed. Thank you.